Okay.
All right. Good morning, guys.
Good morning.
So we are lucky enough to have owners that care about your health. So I know it's hard to find health insurance. So Kirsch and Hottie have met with Dave and Rod here with Charlotte HealthShare. They're going to talk to you today about a new program that they have. It's kind of like a cost-sharing program. It's hopefully going to make your lives a little bit easier and your health insurance a lot more affordable. So, yay! There you go.
And it's going to make you healthy. Thank you, Sarah. Sarah's worked very hard putting this all together for us. So thank you for that. Thank y'all for coming. The caterer will be here, so we'll serve you lunch when we get done here. So we're very, very happy to be here. You know, I think all of us will agree that our country is divided on a lot of issues. Political parties, a lot of different issues. It seems like we're at war a lot. But there's one thing that we will all agree on. Healthcare has gotten out of hand. It's a cost. Everybody will agree to that. And it's forced a lot of us out of the market where we simply can't afford it at all. That's why health cost sharing is your best alternative. And it might be your only alternative for affordable health care. Who knows what HealthShare is? Have you ever heard that term before? Couple? It's not unusual. Health cost sharing is not insurance. It's an alternative to insurance, and I'll explain it in detail as we go through the slides. Actually, it was started in 1981, and they were all faith-based. The Amish church started HealthShare, just like they used to have their barn raisings where everybody came together and they helped their neighbors. They took that concept to health cost sharing. It's a membership organization. All the members pool their money into a pot, and your claims are paid out of the pot. So we're sharing each other's expenses, each other's burden that way. Now, the company that we represent is not faith-based. It's called Sedera, and it's in Austin, Texas. Physicians started it about 6 years ago. We currently have 20,000 lives under coverage through Sedera. So we'll go through this. If you have questions, stop me. Because if you're like me, 2 minutes from now, you'll forget that question. So let's get them answered as you think of them. We're very happy to do that. Total premiums over this period of time since 2008, insurance premiums have risen by 55%. If you have an employer paid, the cost has increased by 70%, and our wages have gone up 19%. So it just keeps going up and up the wrong way. And we're being squeezed by our health care over there. I like this cartoon because the patient's saying, "Doc, can you see the problem?" Here's the doctor. He's looking at the insurance company's ears. The insurance company is the problem. Health cost sharing, one of the wonderful things about that, we take this guy directly out of the picture. There is no insurance company involved anymore. So your health care is totally between you and your doctor. The doctor doesn't have to get approval for procedures like they do now. They don't have to get approval for, I got a pacemaker. The brand of the pacemaker had to be approved by the insurance company. All that's out the window with health sharing. That's why I said you're going to be healthier, because your doctor will control your health now, not the insurance company. This is very interesting because Channel 9 News, this gives health sharing a lot of credibility. Scott Wickersham is an investigative reporter for Channel 9 News. He did a report investigation on the health share industry, and we have a short clip of some of the things that he found out.
Some people are having such a hard time avoiding health insurance these days. They're going a different route, joining healthcare cost-sharing groups. There are reportedly more than 100 of these now, with more than 1 million members.
Susan and Mike Shockley belong to Liberty and love it.
We pay the money every month, and they provide the service when we need it.
Here's how it works. Shockleys pay $349 every month, no matter what. The money goes directly to people who have medical bills they can't pay.
$325 got shared with Trisha and Terrell.
When Mike had skin cancer,
The biggest bill is $36,000.
Liberty paid every penny to remove the cancer from his nose and some lymph nodes too.
We are still getting the medical bills, but so far so good. They're paying it.
So there's over 100 health sharing companies in the country, over 1 million lives. I'm glad Liberty was in this video because 3 years ago, my wife went from full-time to part-time at our church. Blue Cross Blue Shield was $1,200. The Blue Cross Blue Shield agent actually told me about Liberty HealthShare. I'd never heard of it before. I didn't know what the concept was. I never heard of it either. So I had to do my own investigations. And through Liberty HealthShare, they saved us more than half of the cost of Blue Cross Blue Shield. And overall benefits are better. You have the freedom to choose. You lower your monthly expenses. Improved access to health care. I'll talk about direct primary care here in a minute, but we all know, most of us probably know, a lot of doctors are leaving Atrium and Novant because they're tired of the red tape. They're tired of saying you can spend 7 minutes with a patient. You got to see 100 patients per day. So they are now going out and opening their own clinics. It's called direct primary care physicians. It's also known as concierge doctors because they're there to take care of you. One of my members did his first office visit in Davidson Family Medicine, and with our group, he got VIP treatment. If you go in under our plan and you have a doctor's visit scheduled for your primary care doctor, and there's 10 people in the waiting room, you're the VIP. You go to number one. That's how strong our plan is for you. So a lot better treatment. Out-of-pocket cost, that's going to be big, and I'll show you how that works here in a minute. And you're going to be healthier. Now, medical cost sharing itself is designed to take care of your big stuff. Emergency room visits, hospitalization, stuff that really costs you a lot of money and could bankrupt you. And you're probably, if you've got health insurance now, you probably have $2,500 deductible or more. $5,000 is not uncommon these days. Plus you have a copay at the end of that. That's what medical cost sharing is designed for. It's not designed for your day-to-day needs. But our local partners have created our own network of direct primary care physicians to add to the big stuff. So if you're in you go to one of these network doctors, you get unlimited access to that doctor as much as you want. Zero copay. You pay nothing. It's included in your monthly premium every month. So you're going to be healthier because you tend to go to the doctor more, but that doctor is incentivized to keep you healthy so they don't have to see you 100 times a year. So the doctors work. When you sign up with us and you pick a doctor, that doctor will ask you to come in for consultation. They may spend up to an hour with you learning everything about your medical history because their job is to keep you healthy. They get paid the same rate no matter what. That's part of your premium. So they don't want you coming 100 times, but you can if you need to. Yes, ma'am.
Are there specific doctors that won't take this, or do all doctors?
No, it's in our network.
Okay.
We have a network. We have doctors who have agreed, and they're all the concierge docs. None of our doctors are Atrium or Novant. They're all the concierge docs who are independent and can treat you the way they want to. Anything that doctor can do in the office, blood work, x-rays, anything they can do, is all included at no extra cost to you. Direct primary care, and it empowers us to take charge of our own health care with the guidance of our doctor. That's what it's all about. Much better care because they're not answerable to the bureaucracy of Atrium or Novant. Routine services, preventive care, all of that is covered without any out-of-pocket on your part. It's all covered under the plan. Under HealthShare, you pick, it's called the initial unshareable amount. And let's focus on $500 and then I'll explain what that is. That is the amount that Sedera will not share with the community initially. If you go to the emergency room, you go to the hospital, you pay $500 per need. And an individual is responsible for up to 3 needs per year. And if you have more than 3 needs, or hospitalization or emergency room, you pay 0. It's just 100% shareable at that point. And here's a need for you. A break my leg, the ambulance takes me to the hospital. The hospital fixes me up in the emergency room, get crutches, get rehab. That's all part of one need. And the way it works is the hospital is going to send me the bill. I'm going to pay the hospital $500. I'm going to send the bill to Sedera. Sedera is going to send me a check for the entire balance, everything, no matter what it is. And then I pay off the hospital and it's done. Very simple process. You go in as a cash pay because it's not insurance, but the hospital will wait and send you the bill. And then you do that routine I just told you about. And Sedera is averaging 21 days in reimbursements. That's better than insurance companies, quicker than insurance companies. So more and more hospitals are really liking this because they're getting their money quicker. So they won't hound you. Yes, sir.
So is a need just like a hospital visit, or is it you go to the doctor for a sore throat? Is that
That's covered under direct primary care. There's two different memberships. There's Sedera, which takes care of all this kind of stuff. Then there's Direct Primary Care Network through Beacon is our company. So you'll have two memberships. All of your day-to-day stuff is covered under your Beacon membership. That's when you pay nothing when you go see that doctor.
And if the hospital bills you for cash, are they billing you a higher rate than like they had a negotiated amount for insurance?
Actually, it's lower. If you have a scheduled procedure, you call Sedera first. They call the hospital and negotiate the rates down. That helps keep the price down for all the members. It doesn't affect what you're going to pay at the end, but it helps keep our monthly contributions down. But Sedera does all the negotiation. You don't do anything. You just get treated, get what you need, get the bill, pay your $500. If it's an emergency room visit, obviously you can't call Sedera first. You just go get it done. Get the bill, pay the $500, send it to Sedera, and then they will call the hospital and negotiate the rate down. But any insurance company, I've got a good friend who's an ENT doctor. He said anybody that walks in as a cash pay automatically gets a 50% discount. That's just the way medicine works. Yes, ma'am.
So when you go to the hospital, they ask you have insurance, what you say?
You say, no, I'm a cash pay.
But I heard sometimes hospitals for emergency rooms, they keep that against you because they know you may walk and not pay.
They have to treat you. By law, they have to treat you. They can't deny your treatment. And they will send you the bill. You don't have to pay up front. They will send you, it might be $10,000. You don't want to pay that up front. They will send you the bill, always. Then you pay your $500 and let Sedera do the rest of it. So the treatment is the same, and with Sedera, it's good any hospital in the country. So if you're traveling, you're protected under the Sedera piece anywhere in the country. Yes, sir.
So it's some kind of specialty where you having like neck surgery, spinal surgery.
Yep.
You have no choice in which surgeon you want.
Yes, you do. Under specialist, you go anywhere you want to. You'll probably be referred by your direct primary care doctor to the specialist. But when the specialist starts the treatment and whatever they're doing, that comes under the need. So you'd pay the specialist $500. If for his bill, anesthesiology, hospital, any bills associated with that need will be covered under your $500 unshareable amount.
So they didn't have to already join some kind of network.
The direct primary care, and we have a lot of them here in Charlotte. It's a pretty extensive network here that you can go to. So the direct primary care is covered in your premium. If you go to a specialist, that begins the need that falls under the $500 piece that Sedera will cover.
So the primary care is in network, but the Sedera, you go to anybody. And as soon as I go to my specialist, anything from that visit to whatever surgery is $500.
Yep.
It's not like $500 per.
No. That's a need. That's defined as a need when you were diagnosed. When you first went to the doctor, probably you went to your direct primary care first, and then you got referred to the specialist. That's the beginning of the need when you are diagnosed for that. Doesn't matter what it is. That is a need. And I said a while ago, as an individual, you're responsible to fulfill that $500 3 times per year. And then after that, it's 100%. So your maximum out of pocket per year, $1,500 for an individual. If you have family coverage, it's 5 needs per year. And then 6, 7, 8, 9, and 10 are 100%. So 2,500 is your max out of pocket in that situation.
But if we don't use the needs, it's okay?
You
We'll just don't pay that?
No.
Okay.
You only pay the 500 for a need. You don't have to pay it. You're lucky if you never have to use it. That's the intent.
Yeah.
That you never have to use it, but you'll never have to pay more than $500 for a hospital.
In the 500, if you choose that lower amount, I guess your monthly premium's higher than if you choose a 5,000 per.
Yes, it is. It is. And amazingly, the difference. Doing that. Told you I wasn't techie. The amazing thing, the difference between 500 and 1,500 in monthly premium is so small that everybody I sell go for the 500. Now, if you want a much smaller, if you're willing to take the risk of $5,000 per occurrence, then you're on the hook for up to $15,000 per year. At that point, because you'd have satisfy 3 needs if you have that. But there's not much difference in 500 and 1,500. So we always sell the $500 plan.
So if you visit specialists, just the visit, do you have to pay 500?
No, you pay whatever that specialist charges, whatever their cash pay rate is, and then if it leads to them having to treat you for something, you pay up to the $500. If you have to see the specialist several times, you pay the first $500 for whatever it is, and then everything else is covered by Sedera.
There's a question online. How about mental health and pre-existing conditions?
Excellent questions. Mental health is covered. Pre-existing conditions, Sedera does a 3-year look back. They don't go back 10 years, 15 years like insurance companies do. They look back of 3 years. They don't get your medical records because it's not an insurance company. They can't have access to your medical records. So when you join Sedera, you fill out a short application. You disclose any pre-existing that you've had in 3 years. A lot of those don't count as pre-existing. As an example, non-insulin dependent diabetes is not considered by Sedera to be pre-existing. It's covered. High blood pressure that's controlled is not. High cholesterol that's controlled is not. So a lot of things that we would normally think is pre-existing meet the Sedera qualifications that are covered at 100%. If you had cancer 5 years ago and it was cured and you haven't had treatment in the last 3 years, you don't disclose it because it's only what's happened in the last 3 years. So pre-existing could come into play, and a lot of companies will just decline you, period, and not pay anything on pre-existing. Sedera will pay a limited amount for the first 3 years, not full amount, but they will pay something, limited amount, and then after 36 months, that pre-existing illness is totally covered, like everything else is.
Sorry, more questions. So the first question in regards to mental health is if they have like a regular monthly appointment, would that be covered?
If it's for the same, no, not for ongoing mental health treatment, no.
Okay. And then the next question is about prescriptions.
Well, you're bringing up all the weaknesses of my plan.
Sorry.
Let's get them out of the way.
Sorry.
No, great question. No HealthShare company has a prescription drug card where you go to Walgreens and pay $20. All of our clients download GoodRx, and they get deep discounts most of the time, not always, but most of the time that price is less than your $20 copay would be. So you just download it, gives you a list by price, lowest to highest of everything near you and how far away that pharmacy is to you. And then you go in and you show them the app, download the coupon, and you get that price. It's a cash pay at that point. So it doesn't cover, now if it's say for a curative reason, say you go to the hospital, you have treatment, and you have to be on antibiotics or drugs for 6 months, those are covered. What isn't covered is the maintenance drugs that you would go to GoodRx to get. So that is a weakness because some people, medicine's $1,000. Those people are not meant for this plan. So you'd have to evaluate your medicine and what the total cost will be when you save on the premiums too.
And then how about CT and MRIs?
Count covered. That's part of a need. To get those things, you'd have to have a need diagnosed, a reason to do that, so that's all covered. For the unshareable amount, 500 or whatever you did.
And then just to clarify, sorry, last question. If a child needs to go to a psychologist once a month, this plan does not cover that, counting it as a
That's right. That's right. Yeah, that's right. And it doesn't cover alcohol abuse or drug abuse, illegal drug abuse. When you sign up with Sedera, the only two questions you agree to is you will not drive while drinking and you won't take illegal drugs, because those are specifically excluded coverages at that point. So that's all you agree to. When we meet with you, what our goal is, our plan is, after this meeting, you give us your cards, the one who are interested in pursuing this, and then Dave and I will meet with you at a different time individually and talk more in depth about your cost, those kinds of things at that point. And that's when you'll pick your unshareable amount. And it covers illnesses and injuries, it doesn't matter. The medical providers will be the hospitals or specialists that you're able to pick. All right, here's an example of how it works. True to life, true people examples. This family had a small child that had a severe ear infection, had required ENT visits. They had a $5,000 deductible threshold. So they had to pay the first $5,000 of whatever treatment this child gets under this insurance plan. So they went to the doctor, had a series of doctor visits, injections, medicine. Then they had the surgery. So their bill is $2,525. They had to pay every penny of that because they didn't have a health sharing plan. Now here's that same situation. They paid for the first office visit, the second one, the third, and the fourth, and that equals $500. And everything else was shared, so this family would have paid $500 had they been on medical cost sharing through Sedera. And that's how it works. You pay the first amount until it reaches the $500, and then it's 100% shareable after that. Another example, this happens to be my future son-in-law, so this is real. He lives in Cornelius. His daughter had a cyst removed. He's covered under his company plan, so they pay his premiums and all that kind of stuff, but he has a $2,500 deductible. After insurance paid and everything else paid, his bill was almost $2,400. Deductible $2,500. So Marty's paying $200 a month interest-free to pay that off. Had he had Sedera, $500 and he's done. So you save a lot of money on anything dealing with hospital. You're going to save a lot of money. So you got your primary care, you got the health sharing piece. Under the health sharing Sedera, they may require a second opinion, which they pay for. Preventive care is all covered for free. Colonoscopy, immunizations, mammograms, all covered without cost under the Sedera plan. One other thing Sedera has is, you may have heard of Teledoc, where you can call a doctor. It's 24/7. So if you have something go wrong with your child, or you have something go wrong at night or weekends, rather than going to an urgent care, you get a real doctor on the phone. It's not a nurse, it's a doctor who can diagnose that. Call in your prescriptions and it saves you a visit to the doctor. So you have 24/7 coverage through that. Let's skip that one. Okay. We do both small businesses and we do individuals. We do a lot of small businesses because the owners simply can't afford $1,000 a month per employee. And they pass it through, the employees can't afford it. So this is an ideal fit. I know all of you are self-employed. You're 1099, I'm assuming. You have your own companies. So this can pass through your company as an expense, as a write-off, your premiums. It's like I'm 1099 and all my Medicare paid premiums were a write-off. I didn't know that could happen, but it did. So you can write it off. But we also do individuals if you want it that way. So you have total control. All right, the next step, we usually meet with the owner of a company first, like we did with the owner of this company. And because you got to get it past the owner before you can get to the other people. So we normally meet with the owner first. Then we get a census and we price it, send it back to the owner. Then we have meetings where we actually start enrolling people at that point. Okay. Other questions? You got some over there.
So I did have the things like the mammogram that's just covered.
Yes.
Okay.
Yes.
So do you go to your primary care and they refer you? Is how that works?
Yes.
Okay.
Yep.
So that would be the same for an OB/GYN or anything.
Yep. And colonoscopies, any preventive type stuff like that is covered.
Pregnancy?
Pregnancy is covered, but it doesn't come under the $500 threshold. It's at $5,000 out of pocket. And then it's 100% covered after 5,000. That's the only situation where it isn't the 500. Question.
So I think I've already had this in my days, but so
You never know, brother.
So I have 5 kids and they get sick all the time. So those visits to the doctor, those would fall underneath that $500 threshold. And then if a antibiotic or something like that is prescribed, is that something where you have to go through that after mentioning, or is that part of the coverage?
It depends on which one you're going to. If you go to your direct primary care, those visits are free.
Okay.
For 5 kids, you don't have to pay anything. You and your wife and your children are all covered under that plan, so that's for free. A lot of the concierge docs now have prescription drugs in their office that they could give you or give you discounts on.
Mm-hmm.
But the antibiotics would come under the Good RX thing, because that's
Okay.
it's not considered a need if all you do is go to your direct primary care.
Are there child-only options, or do you have to have a?
You have to have a member. You would be the member, and then you could do your child. But we can't write just children. So, yeah, we can do member only, member spouse, member child, or member family. So the 4 categories that we can run.
Well, being a member, I know this one's not a church based. How do we know that you're funded? That this money is enough to cover everybody?
So, great question. That usually comes up much earlier because it is a membership organization.
Right. So do we see the financials or?
It's a private company.
Right.
But Sedera takes 9% off the top for the administrative costs. That's all they take. 91% of all the premiums, monthly contributions, go into the pot for money. Now, to protect us against catastrophic illnesses to where they might run out of money,
Right.
Sedera puts 15% of all of the monthly contributions into a catastrophic pool, earmarked just for the big stuff. So 85% of the money is for your other stuff that's not considered catastrophic. I've researched it heavily. I've never found a health cost sharing company that ran out of money.
Yeah, I'm just thinking cancer can get up to $1 million real quick.
Yeah, and it's covered. Sedera has no lifetime maximum and no per incident maximum. It's covered. Now, in the event they do run short, and it could if they had $100 million claims at one time. It's not going to happen probably, but it could. One or two things could happen. They might just pay 70% instead of 100% if the money isn't there. Then the board will meet and discuss raising everybody's contribution to replenish the pool. And that's how that would be handled at that point.
But they can't do that during a 12-month period.
Yeah, they
could raise the monthly fee any time, or you're not locked in for 12 months.
Unless they run out of money. Our rates are age banded. So, for instance, if you're between 40 and 50, there is no increase for those 10 years. Unless they run short of money, which never happened, but it could. So they don't just arbitrarily raise rates every 2 or 3 years or Blue Cross raise rates every year on a company plan. But yeah, that's the way it works. But they don't, once you get locked in to an age band, until you reach the next band, there's not a rate increase unless they run short.
So how long have they been in business and how do you spell Sedera?
SEDERA.com.
Are you gonna give us a premium cost?
Can,
So how long have they been in business?
6 years. Started by a doctor in Austin, Texas.
So if something does arise, like I get cancer or something, are you able to drop us? Like
No,
would you then
no,
drop?
no.
Okay.
Now, once you're in, you're in. You can drop any time. It's not like an insurance policy where you're locked in for a year. You're month to month. It's your decision. Yeah, well, they're all self-employed. What he said was it's for employers who have employees, this coverage is portable, which means the employee can take it wherever if they leave that company. Just pick up the premium themselves.
So do you have like a slide for like examples of 52 years old, pretty healthy, what that costs?
We do that individually, because everybody's situation is different. And I do have a price sheet here if anybody wants to talk about
I do.
pricing.
So you don't need a group, premium agreements with our individual.
That's right, that's right. And I know some of you have teams, some of you have administrative assistants. Those would be W-2 employees. If you want to make it available to them, you can. You can choose to pay part of it. If you had an insurance policy and you made it available, you'd be required to pay some of it, and you'd have a minimum participation amount. So many had to participate. But under HealthShare, there is no mandatory company contribution. You can pass it all through if you want to.
Not at this time.
What's the answer?
Not at this time.
The answer is no.
Can you run back through the process as far as handling the paperwork, the bills, and how that typically?
Yes. You go to the emergency room, you go to the hospital, you tell them you're cash pay. They treat you, you go home, they send you the bill. You pay the hospital $500, or whatever your initial unshareable amount is, whatever you choose. But I always pitch the $500. So you pay the first $500. You send that hospital bill to Sedera. They send you a check for 100% of the balance. They send it to you as a reimbursement, and then you give it to the hospital, and you're paid up. People ask, what happens if I get the check and I go on a cruise? That's between you and the hospital. Sedera, as soon as Sedera sends the check, they're out of the picture. They fulfill their obligation at that point. So it's up to you to make sure that your providers get paid.
Would you say this is an annual program or it's a month?
Month to month.
Okay.
Yep. You don't pay your premium once a month, you're out.
Do you have to create families under the program even if you're not married?
You have to be cohabitating. And it covers dependent children up through 25. What else?
That's hard to kick the kid out if you can cover him to 25.
I know. And the definition of dependent child is so wide and broad. I've got a client that both of the children live out of the house and they both work full time, but they still are considered dependent children. I don't know why it is, but that's the way it is.
So I guess I was coming here expecting to get an idea what my monthly fee would be for Blue Cross Blue Shield.
You want to know right now?
Yes.
Yeah, I mean, I don't know, like, we all
Give us the numbers.
want this to be a waste of everybody's time.
That's why I said we
Wasting my time.
typically.
I'm pretty sure that 500 wasn't being true.
All right. If you're 30 to 39, it will be $306 per month, including the unlimited direct primary care visits.
That's for one person, not a spouse?
That's for one person. I do it all individuals right now. It's too much to get into in a group session, the different categories.
Is that under the 500 plan?
Yes, yes. 40 to 49 is $328 a month. And please remember, these include your primary care visits at no extra cost. 50 to 59 is $373. If you went to Blue Cross, you'd be paying $1,000 in that age bracket.
Or more.
Yeah, more. It's $353. Your maximum out-of-pocket exposure is the $500 if you pick that one. And there's no copay. Blue Cross, you have to pay $80.20 plus your deductible. There's no copay. It's strictly the $500. 60 to 64 is $573.
60 to 69, 573.
Yep.
Big jump.
We're getting old.
You're more likely to need it. Of course, after 64, you're on Medicare, so that we don't write anybody past age 64.
It's 65 for Medicare.
I know, that's why we write through 64,
Oh, okay.
and then you're on Medicare.
Gotcha.
We got a youngster here. 284, I think.
Oh, that's awesome. 284.
Yeah, 284. From 18 through 29, it's 284. So there's no way in the world you could ever get a better price. There's no way in the world you could ever afford an insurance policy with only a $500 deductible. There's no way you'll ever have unlimited access to your direct primary care doctor like you do under this plan. And all of that is covered under the rates that I just gave you. Yes, ma'am.
So, like an OB visit would be considered under primary care, even if it's a different doctor?
No, direct primary care is a specific plan that you have to get to.
So, even for like an annual visit for a woman, you'd have to pay the $500?
No.
We pay whatever they require.
Yeah.
So.
Okay, so you just pay like out of pocket for
Yeah.
cash.
Up to 500 and then it's covered up.
Okay.
For that.
And we could go to whoever we want
Yeah,
for that.
so anywhere you want to go. Yes, sir.
Do you have a list of those primary care?
Let me pass it around the room.
Are you in multiple states or just here?
Sedera, actually, yes, we can ride anywhere in the country. Sedera is nationwide. The doctor network is all local because this is where we started and we're building the network. But we have another source for your direct primary care outside of this area
Okay.
that requires a minimum number of enrollees to get into that plan, but we can write you anywhere.
Okay. Do you have any way to get copies?
Yeah, make a bunch of copies.
Okay. Make a bunch of copies.
So if we have, like, for those that are online, we have offices in Western North and Asheville, Lanesville, and out on the coast of Wilmington.
Yep.
So do you have a South Carolina and South Carolina, a separate list?
When we enroll people that we will go find the direct primary care doctor at that point. We don't have them. We have one in Charleston and we have some in Rock Hill, but we don't have any on the coast. We will go find them for that network.
And then usually the primary care doctors within like a NOCON or like a major network? No, or is it?
They're gonna be little niche doctors.
They're all concierge independent docs.
So let's talk about that because not all concierge independent docs are qualified to go to these hospitals. They're not hospital certified. You know, now they've gone to this doctor and then the hospital has their own doctors. Or
You know, the doctor has, I don't know.
not all of them can go.
I don't know. We have not had that situation arise where they're denied it's called privileges.
Privileges. Not all of them have, and nobody don't have Carolina and vice versa, and they've gone to hospitals. That's the word. Yeah. So your doctor doesn't even sometimes can't do.
I haven't had that situation arise.
Okay.
That's the best answer I can give on that one. We haven't had that happen. 90 doctors left Atrium last year.
Yeah. No.
And went to Tryon Medical Group. 40 doctors left Novant and started Holston Medical Group. So they're leaving in droves because they want to control their own destiny and they want to treat you how they think you need to be treated.
Do you use Tryon Medical? Is that part of the network?
We're working on getting them. Yeah, they're not in the network yet, but they will be. We're adding docs as we go. I think there's over 100 doctors right now because some of these clinics on that sheet have multiple doctors. There's not just one doctor. Like Davis and Family Medicine has 5 different doctors that you can see. Yes, sir.
So it covers your annual physical stuff, everything.
Yep.
What about outpatient?
Yes. It's limited, I think, to $1,500 per year. They're all limited, like Medicare, unlimited, so many visits.
But I have to go to the outpatient.
No.
In that list.
No.
The only person that's in network is the primary care person.
Yeah.
So what do you mean chiropractic is covered? You have to pay that $500 first?
No, it covers up to, I think, $1,500 for chiropractic.
Oh, just like,
Yeah.
you pay nothing
Yeah,
until
you're limited to
$1,500.
X number of visits per year over what your chiropractic charges.
What about dental and vision?
No insurance plan, no health plan includes dental and vision. Those are always supplemental benefits. You pay extra for those. So we don't offer that. But those are easily found.
Well, there, do you have like one of those you could recommend? There's like
Yes.
a combo of those?
Yes. I actually partner with a couple of supplemental agents that we can send you to if you want to.
So when do you think you'll have Tryon?
What time I have what?
Tryon Family Medical.
Oh, I don't know. Eric Kirsch, he's a physician. That's his job is to enroll other doctors.
Oh, okay.
And he's already meeting with Holston Group to try to get them.
Okay.
Traveling outside of the country.
Yeah, I was thinking that.
You're covered. You're covered with a Sedera piece, which is what it's going to be an emergency if you go outside of the country. It's going to be an emergency. You're covered.
Anywhere?
Yep.
You just made my day.
You're diagnosed with diabetes this year, you get $500.
Yep.
To do all that. Now
Yep.
the next year you get another $500 because you're diabetes.
No, not if that's the same need that you're being treated for. That's the beginning of the need.
So need can last about.
Yeah. The example I gave with the broken leg, you pay the $500. Let's say 6 months from now, something is wrong with that same leg. The doctor did something wrong. The pin came out. That is part of the original need. So you don't pay the $500 again. You've already paid your obligation for that particular need. So it's all based on need and when that need begins.
So what are the columns out to the right?
That's the portion that we pay to the direct primary care and per child. It gives you the per child piece also.
So we don't pay that.
It's part of
You
your
guys
monthly
pay that,
premium. Yeah, it's part of your premium.
What's the time period? What's the first line? $69 for an adult.
We take your premium. You pay that as part of your premium,
Mine is.
and that's all you do.
$1,300
We send that doctor $69 every month, whether you use it or not. So they have a guaranteed cash flow. And for that, you're treated as much as you want with no cost.
That's
So
a per month.
Yeah, that's
So
part of
is
the
the
premium.
doctor-
Yeah,
That's
part of
what
the
I
After
get.
we pick, could that change our premium, or does that not be different?
It could. You don't want the $150
Oh,
out
no,
there.
she did.
That kind of stuff. We average about 75, pretty much what the range is.
So our premium is based off of like what doctor's primary care, or how old we are, what if we have under us, all
Yeah.
that.
Well, it has
And
nothing to
you,
do.
everybody's is different.
Your premium isn't based on your health. It's age banded strictly. It's
Right.
not by gender, it's strictly by age.
Okay.
Plus what doctor you pick.
So the monthly rate you gave us could vary.
Yes. Yeah. Slight. Yeah. Could be less.
This is just an average, I guess.
Average is 75. That's the number that I used when I was filling out rates for all that. There's a couple on there that's only 50.
Those are rates you negotiated with these doctors.
Yes, they get paid, we pay them every month. You don't. Comes out of your premium, we take your premium.
So
and
that
we
gives
pay
them a base salary to work off of.
Gives them a guaranteed income, that's their incentive of being in our network, because they're gonna get $75 a month. And they, whether they treat you or not. So it's a good deal for the doctor, they want it, because they have cash flow. And it's good for you, because you get better quality service for no other out-of-pocket expenses.
Now, why would we choose you over another company?
Look at me.
Because you're nicer? You came here?
The gray hair, people trust me because of the gray hair on me. The other health sharing companies do not have the direct primary care piece. We bring everything to you.
To one side.
Yep.
I like that.
Now, you can go anywhere you want to, but we think that ours is the best, obviously, just like Remax is the best.
Right. Yeah. I like the direct care. So that's really good.
Can you talk about the enrollment process?
Oh, it's very, very simple. We have a contract. Put your name on it. I get all your bank account information. We have an enrollment form, very simple. And then you will get an email with links introducing you to your direct primary care that you selected and how to get in contact with that direct primary care. And also a link directly with Sedera. So you'll go on that link and you will sign up with Sedera directly for that membership. So keep in mind, you got two memberships with us. You got Sedera and then the direct primary care membership.
It's all one premium.
Yes, yes, one premium. Doesn't go up unless they run out of money. So you're locked in until you reach the next age band.
I just got a raise.
How much are you paying?
I pay $1,300 a month with a $7,500 for one person.
You ready to sign up today?
Yes, I am. I'm hoping you'll sign me up today. And I typically rarely get sick, so I am paying a $350 annual physical is what all that money goes to.
Yeah, the way this will work is if you run it through your business, we will get the business checking account information and we will debit that account every month for the total premiums.
Okay.
It's a very simple process.
Can you sign up whenever, or is there like open enrollment?
No, this is not insurance, so there's no open, you can do it anytime you want to. And as long as we have your paperwork in by the 15th, you're covered the first of the next month.
Oh, yay.
So it's only a 2-week process.
Can we require friends to use it or don't work for you now?
Yeah. Oh yeah, we can write anybody. That's so we started out just doing small business, but now we've opened it up. We will do individuals. Yeah. We don't heavily market individuals, but certainly we'll write anybody that wants it.
So if I have a family of 4, 2 children, is it per person or is it unlimited kids?
Yeah, can you give us some prices here a little bit?
You should be writing all that.
All right, let's say you had a family of 4. You want member family, which is spouse and children. You're 40 to 49. It's $630 per month plus the direct primary care fee. And that list includes the children's fee as well as the member's fee. Direct primary care, the Sedera piece is $630.
Okay.
Then you would add.
Add this number?
Yeah.
Per person?
Yeah.
Oh, so this is in addition to
Per person.
the monthly number.
The one I gave you is assuming an individual has $75 direct primary care.
Okay, that was 75 is included.
Yes, that's included in it. It could be less or it could be a little bit more depending on what doctor.
Per kid. Is it per kid?
Yeah.
On this one?
Yeah.
Per person or small?
Yeah.
Can you give me?
Or is it 175 or 475?
It's, well, you have an
Family
adult
of
rate
4.
and you have a child rate.
Oh, okay.
So it'd be two adults and then ever how many children. you have added to that.
Can you give me what the member plus child?
And you're 18. So 347 plus the direct primary care fee.
So if I understand correctly, if I was to go to Park Road Medical that I already have a relationship with, and I'm 56, so it would be $373 a month plus the $100.
No, this 373 already included the average of 75 that I added to it. So it would be 298 plus 100, 398. Is that what that fee is, 100?
Yeah.
Yeah, 398.
I am a happy camper.
373.
Right, so you're saying your individual and number. So,
At an average of 75.
Spouses for, so just, an individual and a spouse together would be
40, 49, 30, 30, 39.
39.
What age band?
Oh, we're in 30 to 39.
For what, and is you and a spouse? 402 plus the direct primary care fee. All of these rates I'm giving you are almost always 50% less than Blue Cross.
Yeah. Thank you.
Alright, so it would be, is it 402, so it would be
Plus
477.
Whatever doctor you
Yeah,
pick, you and your
he was
child.
averaging 75 per person. Oh, wait, 75 and then, so, yeah.
Well, I'm gonna wrap up the
Okay.
webinar, and I guess we're just gonna figure out to have lunch.
Right,
So you can ask questions, sign up, whatever you want to do. Yeah. Thank you guys for being here.
Thank
You're welcome.
you.
Thank you for your attention. I tell you what, you really,